I'm Leann,
I'm Samantha.
I'm Marissa. And I'm Cassidy.
and we're SALIS students with the Speech-Language Pathology program doing our Capstone project on aphasia awareness and advocacy. The purpose of this presentation is to increase public awareness to the obstacles faced by individuals with aphasia and to highlight how increasing the public's knowledge about these challenges can decrease these obstacles. Some of the research findings on this population looks at the community-based programs and seeing if they're accessible. The findings of this study showed that these availability are low, and some of the negative impacts were that there's not enough qualified personnel that have aphasia-specific training, and that there's a general lack of knowledge within the community about how to improve this accessibility. Another study shows that there's a decrease in the participation because of negative attitudes in the community, as well as no accessibility to communication partners. Factors that can increase the participation were the reverse of these. So that's increasing the knowledge within the community and having the community have any familiarity with somebody with aphasia. The last study that we looked at was showing that there's a significant increase in 5 out of the 6 areas covered by the psychological well-being scale for both individuals with aphasia and their caretakers. The psychological well-being scale measured the 6 areas of autonomy, environmental mastery, personal growth, positive relations with others, the purpose in life, and self-acceptance. The one area that individuals with aphasia did not increase during this study was positive relationships with others, but they had significant increases in fulfillment in life and boosted feelings of independence, whereas caretakers did not have a significant increase in environmental mastery, but they did have increases in positive relationship building and their confidence in their role as a caretaker.
So, what is aphasia? Well, according to the National Aphasia Association, aphasia is an impairment of language affecting the production or comprehension of speech and the ability to read or write. Aphasia can range in severity. It can be very mild and only impact one aspect of language, or it can be very severe, impacting several areas of language.
And then according to ASHA, which is the American Speech Language Hearing Association, aphasia is an acquired neurogenic language disorder, and it has 4 primary areas of impairment, which is comprehension and expression of spoken language, and then reading and writing.
So when looking at the incidence and prevalence of aphasia, the incidence refers to the number of new cases identified in a specified time period. And according to the National Institute on Deafness and Other Communication Disorders, it's estimated that there are 180,000 new cases of aphasia per year in the United States. And according to the prevalence, which refers to the number of people who are living with aphasia at a given time period, there's 1 million or 1 in 250 in the United States today that are living with aphasia. There's no significant differences that have been found in the incidence of aphasia between men and women. However, some data does suggest that differences may exist by type and severity of aphasia.
So what causes aphasia? So stroke is the most common. There are 2 types. And then after stroke, if someone has a traumatic brain injury, a brain tumor, they have brain surgery, an infection in the brain, and then a neurological disease such as dementia. And then this graphic here shows the types of aphasia, and there are 8 types. So for example, if you go down the red side, so they are fluent, they can comprehend, and they are able to repeat, they would have anomic aphasia. And then if you go on the other side to the gray line, they are not fluent, they cannot comprehend, and they cannot repeat, they would have global aphasia. So the effects of aphasia, there are 4 effects. So there's deficits in spoken language, which we said were expression and comprehension. So expression would be like finding words, like difficulty finding words or making up words. Comprehension would be difficulty understanding spoken language, so understanding when people are talking to you. And then they would not necessarily be reliable in answering yes and no questions because we're not sure if they're actually understanding the question that's being asked to them. So deficits in written and reading expression are the other two effects of aphasia. So in terms of written expression, they may not be able to write anymore or even copy letters, numbers, words, sentences, and they just might write nonsense words. In terms of reading, they might not be able to read books or newspapers anymore, and they might not be able to recognize words by sight or by sound alone.
Aphasia is diagnosed by a speech-language pathologist, and the areas that are assessed are the individual's ability to speak, understand language, read and write, and a diagnosis can be made following an indirect or a direct assessment. So examples of an indirect assessment are direct interviews with family and caregivers to discuss the language differences after a stroke, and you can also gather a language sample through conversation with the individual with aphasia. There are standardized tests that are available for identifying what areas are affected and to what degree.
Okay, and then there are four main parts for assessing aphasia. They would be case history, patient self-reports, an oral mechanism exam, and then standardized assessments. So for a case history, you want to look at their medical history, what type of medications they're on, any surgeries, any other diseases, what type of education they have received, maybe what their occupation was or is, and what languages they speak. In terms of patient self-reports, we want to know if the patient is recognizing any speech or language difficulties within themselves, or if any family or friends have noticed these difficulties. An oral mechanism exam is when we're looking at the structures of the face to make sure the strength is okay, range of motion of your tongue, your cheeks, your hard and your soft palate. And then any standardized assessments, which would be the Boston Diagnostic Aphasia Examination or the Western Aphasia Battery, they would just give an actual diagnosis of aphasia and what type.
So a study completed in 2012 by Johansson et al. Found that individuals with aphasia had fewer conversations overall. Most of these conversations were with family and close friends only, and they found those conversations to be more difficult and frustrating. Individuals with aphasia appreciated when others initiated the conversation or took interest in talking to them. They felt lonely when listeners didn't have the time or didn't understand what they were saying, and they felt that their contributions to conversations were ignored, especially when making decisions and planning. Individuals with aphasia also stated that there are several environmental factors that have impacted their communication, and those included the negative attitude others may have, the lack of knowledge surrounding aphasia and strokes and the difficulties that they have with communication, and a lack of availability of a communication partner who understands or is patient enough. That same study from 2012 also found that family members and caregivers' communication was impacted, and they felt as though they were the main contributor to the conversation. They facilitated the majority of the conversation, about 70% of the time, and approximately 64% of family members and caregivers stated in the study results that their interactions were overall less enjoyable and less stimulating. When family members participate in speech therapy, it can improve their communication with their loved one with aphasia, and it can help them feel more support throughout this journey.
At this time, I'd like to welcome and introduce our first presenter, Dr. Denise Mendez.
Thank you so much. I am Denise Mendez, and I am an individual with aphasia. The journey for me with aphasia came into May of 2017. I was on my way to a conference, going to the airport to North Carolina, and I was having a really bad migraine. And all day, it was just terrible, terrible, terrible. Got to the airport, and I needed to talk to one of the persons who worked there, and I couldn't make them understand what I was trying to say. And I was very, the pain in my head hurt so much that I just let my friend do it. And, I was like, just find out where we have, where are we at the right gate, whatever, that kind of thing. But I just assumed it was a migraine. I did not really think of anything else other than migraine. So the next morning, as we're getting ready for the conference, that was the worst day I ever felt in my entire life. Like, I just had this feeling of doom. I just felt really bad, and my head hurt so badly. Even with medicine, the pain was not going away. But we went to the conference anyway, because that's what I do. So I go to the conference, and at the conference, we have to introduce ourselves and talk about the team that you brought in and what changes you've done for the school for the year, et cetera, et cetera. And I'm thinking, oh my gosh, I can't get it together. I couldn't even think of how to say to pronounce my name. So I just said to my friend, I said, you do it. So as time goes on, she kept saying, are you okay? Are you okay? And no, I'm not okay, but it's all right. I'm trying to take notes during the conference. She thought I was just doodling, but I was trying to write, but it was like letters this big, and I could not make letters. It was no sense of it. So at that point, we said, we better go to the hospital. So we go to the hospital. At the hospital, they are, doing the intake. And they're saying, what's your birthday? What's your name? And I could not get it. And immediately they said, hey, come with us. And they took me to another room, and they did a CAT scan. And they found that my brain was bleeding. So that was the hemorrhagic type of stroke. So they immediately sent me to another hospital, Wake Med in North Carolina, great hospital, and they took good care of me there. So I was there for 5 days, and then I was able to fly back to Philadelphia and get home. So while I'm home, then I started with therapy. Had speech therapy, had occupational therapy, physical therapy, and I can't remember anybody else, but I think that was it, those three. The majority of the impact of the the bleed in my brain was on the left, well, it was all over on the left side, but it was on the speech area. Physical therapy was very short. It was really just to make sure I wouldn't fall and I could walk. My right side of the body is a little weaker than the left side. Occupational therapy was more about so I could do things independently. My sister from New Mexico came and stayed with me for about 3 months because somebody had to take care of me. I was leaving the stove on all the time. I would just walk away. I'd forget. I mean, I wasn't thinking about it. And really, at that point, I didn't know that there was a problem. I mean, I knew it was a problem. I knew my brain had been bleeding, and I was on a lot of medicine, so I was kind of doped out for a little while. But therapy went on. I left from being at home to at the hospital having therapy. But then I said, look, I got to get this better. So I got to find some other things. I need more therapy. I need some support groups. I need whatever. And thank God I found Salus University. So over here, I had more therapy because, insurance companies, for whatever reason, they do not give you, for speech and language, the same amount of therapy as you would as if it was physical therapy. But that's another story for another time. So anyway, I'm moving on, and I am improving, I am recovering. The Bleeding, though, came back on February 29th of 2019, so 2 years, like a year and a half later, which was actually a good thing, because then they were able to diagnose that I actually had what they call an angioma, or an arterial, let me say it right, arteriovenous malformation, which is a congenital thing. It's been in my head all the time, but we didn't know. That was why I would have all these headaches for years, for like 20 some years. And the neurologist said, probably you never had migraines. It probably was little tiny bleeds in your brain. But anyway, I am recovering. I'm recovering. I had, like I said, a lot of speech and language therapy, a little occupational, a little physical. But the impact of aphasia on me was, the first thing that was very important to me was that I have to be able to drive again, because I need my independence. I cannot. I needed it. So it was 7 months before I could drive again, after an evaluation at Moss Rehab. Then they said, okay, you're fine, you're legal, you can go. My writing is impacted. I'm a writer. And I'm not going to say I was a writer. I still am a writer, and I will be writing more. I write creative things. I write plays. Several, we've actually produced them. And I've got a couple of books that I'm working on right now about this whole situation. My reading is impacted as well. I am the dean of our religious training institute for our church. But I can't read fluently, so I can't teach any classes right now. And it really makes me very nervous, especially anytime I have to read anything out loud. My memory has been a little impacted as well. I used to know all the songs to anything. I could win on any guess, on show, those TV shows, guess that song. I could do it. I can't remember any songs. I mean, like I know the song, but by the time I'm ready to say what's the word of it and to actually get it out there, oh, forget it. And then there's also the cognitive language processing part, the understanding. What would be really helpful, at least for this person with aphasia, if everybody just spoke more slowly. That would help so much, because it gives you that wait time to actually think, did I really understand what you were saying or not? And the other thing that's kind of weird, and I don't know, maybe somebody's going to do some more research in this, has to do with the phonetics. So when you're trying to read, in my brain, the phonics don't work anymore. The sound, to try to break out a word, like I saw that on your slide here, to sound out a word, the letters and the sounds don't work anymore. So I don't know. But anyway, I am very passionately right now about advocacy for aphasia, very much. Self-advocacy and advocacy for our community. Because, you've seen the data that was presented here. We've got to do better. We've got to do better. There are support groups at the university. I attend here at Salus. There's one at Temple. I know there's one at McGee. I don't go that much too far, but they do have that as well. My message to everyone to understand is that persons with aphasia have not lost their intellect. It's just the ability to speak and to understand the language. And last thing I would like to say is this. Yes, I do have aphasia, but aphasia does not have me. Thank you very much.
And our next speaker that I would like to introduce is Tony Lennon.
Hello, I'm Tony, my wife Bonnie over there, and her sister Bobby. Unfortunately, my wife sustained a stroke in January of 2018, just standing in the kitchen, and it just hit her out of nowhere. We got rushed to the hospital. They gave her the CAT scan, and fortunately, the doctor there gave her the TPA, which prevented her from having an operation. And as a result of that, we was at Lady of Lourdes for 5 days, and then in turn, they transferred us to Morse Rehab. And she was at Morse Rehab for approximately 5 to 6 weeks, where they did all physical therapy, occupational therapy, and the speech therapy, which the aphasia definitely affected her there. And that's what we're doing now. We're once a week at Salis, and we had a great therapist, Leann. Body's a good friend, and as such, I became the caretaker. My wife has a history of unfortunate situations. She's in remission from 4th stage lymphoma, which she had back in '06, and in turn, after that, it damaged her heart muscle, which gave her congestive heart failure, which in turn we found out actually caused the blood flow to slow down, and in turn damaged the brain, which in turn gave aphasia. The part about Bonnie is she can do it all except speak. She understands everything. She does everything physically, and she's my best partner. Matter of fact, anniversary's coming up next week, 42 years. Okay. Got a buddy here next to her, sister Bobby. It's tough. It really is. I mean, the part that with Bonnie is she wants to relate to us. She really does. Every day, she gives me a shopping list to go out. She can write. She knows the words and all. And we watch TV, and she knows, unfortunately, though, she cannot put the words together. You know, she cannot, and that's the tough part. But again, she's a fighter. She has all the, I don't know what else to say about that, but she really definitely, being a caretaker is just something that I could just do. It's automatic with me. I mean, I've had great, Salis does wonders. Like I said, Leann, and once a week we went there and they put the words together. And we had a homework book that she made for us. And we would go to Mass, and that was the other part. We would go to Mass on Sunday, and she had trouble when the Our Father came up. And then I mentioned that to Leann, and you knew that the next week, Leann, we were saying the Our Father, and it was really great. So now on Sundays we knock out the Our Father. Now we're finding out we're going to do the Hail Mary with Jill next week, and we've been doing that. And besides that, I got to tell Leann too, she found out her favorite song was Raindrops, and she did that for us. But anyway, I mean, it's a difficult thing as far as her is the frustrating part. That's the part that really she wants to say it and relate to us, and we feel frustrated and for her, but she fights through it, and she's just been a fighter all her life, especially with the physical aspects, and I don't know what else to say as far as that. It's aphasia just tears it apart. I mean, it just takes her independence away, where she can't relate to us. I mean, that's in essence what it is. Bobby, you want to say something? Is her sister, Bobby?
Okay.
Thank you very much.
Bonnie is my sister, and we have developed a kind of 20 questions charade type of atmosphere where we manage to figure out what she's saying. We don't give up even when she tries to give up. We say, well, just tell us again. We'll figure it out. We have found that most people, relatives or whatever, if we explain to them what has happened to her and that she can understand but she cannot respond, that people will relate to her and try and talk to her. That will talk to her. Now, the conversation, unfortunately, tends to be one way, but Bonnie does manage to relate to them and to talk to them as well. I've had friends who have come to the house and they understand what's going on. So I think if people are aware of it, you let them know what has happened. Don't leave the person with aphasia in any sort of isolation or sort of hide them away. That people will do what they can to relate to them and to talk to them. And I think that, so involving the community and involving, just letting people know what has happened, I think that they're willing to work with you. They're actually anxious to talk to people and to let them know that they don't want them to feel isolated. Okay.
Thank you so much.
All right, I just want to give a thank you to our speakers. They were a wonderful contribution to our presentation, both to hear from an individual with aphasia and family members of an individual with aphasia as well. So to wrap up our presentation, we're just going to talk a little bit about different therapy approaches for individuals with aphasia. So the two main types of treatment approaches revolve around restoration and compensatory strategies. So restorative type of treatment approach looks at restoring, retraining, and improving the impaired functions. And compensatory strategies look to teach different strategies to use for deficits that cannot be restored. Therapy decisions are always based on the individual's wants and needs. We also, as clinicians, incorporate and encourage family members to be a part of these therapy decisions as well. Therapy will differ based on the severity of aphasia, and it will change over time as the individual improves. So looking at the service delivery models, once a treatment approach is decided upon between the clinician, the client, and the family, it's important to consider different service delivery options. So one thing to be conscious of is the format. Is the person going with aphasia going to benefit the most from individual therapy, one-on-one with a clinician-client type of setting, or in a group setting, or a combination of both? Here at Salus, we offer an aphasia support group that we have weekly meetings, and different members get to come and share their stories, and that's been a very helpful and beneficial part to these individuals' therapy and rehab. Another thing to consider is the provider. So is it going to be an SLP-based providing the therapy, or are we going to involve the family and the caregivers? It's always best when we can get the family and caregivers involved, because they're the ones that are with the individual with aphasia majority of the time. We also want to look at dosage, how frequent and intense, and the duration of the service that we're providing. Timing is related to the onset of aphasia and when therapy is going to begin. And lastly, we look at setting. So is therapy going to be based more in a clinical setting, in a public or social setting, in almost a group format, or based in the home? And some different types of treatment options. There are many out there. As we heard and as we've talked about briefly, aphasia can affect many different aspects of language, and there are many treatment options that are out there and available. A couple that we'll touch on is community support and integration, computer-based treatment, constraint-induced language therapy, melodic intonation therapy. As Tony mentioned, him and his wife work together on singing songs, which is a great therapy for individuals with aphasia and word finding and fluency. Other options are multimodal treatment, partner approaches, reading treatments, reciprocal scaffolding treatment, script training, syntax treatments, and word finding treatments. Word finding is a big part of aphasia, and there are a lot of options when it comes to treatment for word finding.
So then lastly, we just have some resources that we wanted to share with everyone. So if you go to ASHA.org, it's the American Speech Language Hearing Association, where you can find out a lot about aphasia. There's also the National Aphasia Association, which is aphasia.org, or you can come here to our Salus University Speech Language Institute, and we have our aphasia support group and then the one-on-one treatment with the SLP. Thank you.